It can be really tricky with bipolar disorder because some of the symptoms of bipolar disorder can feel really good. So people themselves might not notice that there's a problem.
To make a diagnosis of bipolar disorder, you have to see either a manic or a hypomanic episode. A manic episode is a period of 1 week where a person needs less sleep in order to function during the day, more outgoing, they tend to be more talkative. Most people report some form of racing thoughts. There can be grandiosity where they think that they are a god of some sort. They can tend to engage in risky behaviors like spending or sex or drugs or alcohol. But you have to see a manic episode to make a diagnosis of bipolar disorder. And again, there is also hypomanic bipolar disorder, which is it's a sort of lower level of a manic episode, but you need to see at least one of them in order to make that kind of diagnosis. Because it's so tricky to diagnose, and because the symptoms can map on to other diagnostic conditions, it's often misdiagnosed.
Bipolar disorder is a clinical diagnosis, as are all mental health disorders pretty much. You would see your clinician, who would ask about your family history to see if that's something to be concerned about, then would go over your symptoms with you, particularly looking back at your history. So typically what I see is someone come in really presenting with depression and thinking that they need help with their depression. But what's very important is that your clinician needs to look for any past episodes that could qualify as hypomania that you might not have realized, because that will really change how they decide to treat you for this depressive episode.
Sometimes it involves bringing a family member in because a person that is engaged in or in the midst of a manic episode maybe not the best reporter. So you sometimes have to ask that person's family members how they've been acting in order to really get a complete picture of what's been going on.
After my breakdown, and the doctor had a sense, I guess. He asked me 20 minutes worth of questions and then asked my husband the same questions to make sure I wasn't lying. He said, bipolar 2 disorder.
In fact, people in hypomania may be feeling really pretty good. I don't want to go in for treatment. I feel great. I don't know what you're talking about. So it really is incumbent upon others to note in family members or in friends something is going on and to help them to seek treatment.